Dallas Regional Medical Hospital, Mesquite, Texas. Everybody needs to share this video. Black women are not treated fairly. Black women are not treated equally. This is insane and inhumane, and it must stop.
This is your third pregnancy?
Yes!
You have 2 babies
It's
at
in
home?
my ass!
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
There was a personality patient for you. Last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due
I
date is
just
the
said it
10th.
was the 10th.
I think her due date's the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people here.
I just watched something that absolutely disgusted me. As a former ER nurse and a current labor and delivery nurse, I usually try to seek the best intent of a nurse. Not today. Not today. Because barring you having a medical emergency yourself, where your legs, your arms, and your voice no longer work, there is zero excuse for the blatant neglect that I just watched. And as a reminder, Black women are 3 times as likely to die in and around childbirth than their white counterpart. Part of that is because they are not believed about their pain. How you can sit there on the computer and act like you don't notice that this woman is actively birthing beside you is crazy town to me. Unacceptable, inexcusable. And if you've got coworkers who you watch do something like that, you are just as culpable.
Hey guys, I'm here with Mom and Baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He still have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and the fluids was green, and like I said, he born with his eyes open. So they are, you know, taking all that in consideration as well. But he's eating well, sleeping well, looking good. And I was also reading a lot of the comments, and some of you under the impression it was twins. They are not twins. This is daughter with baby Cash, and this is other daughter with baby DJ. They are a month apart. DJ born 10-10 and KJ born 11-11. Thank you again for your support and your concerns, and we will most definitely keep you updated.
Now, see, this is exactly the shit that makes me say bullying needs to make a comeback. Because clearly embarrassment is the only thing that makes people do their fucking job. Let me say this loud for the people in the back. Stop going into healthcare if you cannot show compassion for all people. If you haven't seen the video of the woman in active labor who sat in the waiting room for 30 minutes before even going into intake at the Dallas Regional Medical Center in Texas, which is extremely confusing because they offer labor and delivery at the hospital, and they say on their websites they pride themselves in compassion and comfortable care for mothers. But is the compassion in the fucking room with us? Now, if you've ever given birth and you know that pressure you feel in your ass, that's the body's final warning. And the lack of urgency in the fucking room was loud. Surely they should know that this could be extremely dangerous. Delaying care like that puts both the baby and the mother in extreme risk. Loss of oxygen, emergency delivery, hemorrhaging, fetal distress. This isn't a small mistake. This is a mistake that can cost a life. Pure negligence. And if this is how they treat women on camera, imagine the shit that they're doing when they're not getting caught.
My father lost his mother at 16 years old due to medical malpractice while she was pregnant with a set of twins. She walked into a hospital and never returned home to her children. When I saw the video of this white nurse ignoring the pain of this woman that is clearly in labor, in active labor, I was absolutely disgusted. Not only was that sister's information already in the system because she was due to be induced that day, but this nurse, who people have identified as LaCrista Vaughn, nonchalantly handled this woman during this emergency, to which she literally delivered her son 12 minutes after. And for those who say that this is not about race, it is always about race, especially when it comes to Black people and especially when it comes to Black women in the medical system. The maternal mortality for Black women is 10 times higher than any other demographic in the United States of America. There are still racial biases that assumes that Black people can handle a higher threshold of pain to where we are not tended to, nor giving the proper care or medication to mitigate that pain. This book by Harriet A. Washington called Medical Apartheid literally details the history of medical experimentation on Black Americans in the United States. And also talk about how a lot of gynecological practices and advancements were as a result of testing Black women's bodies without medication or anesthesia. For me, it is not enough that LaCrista Vaughn loses her job. But white folks, it is time for y'all to stand up and stand within the gaps, because Black folks have been yelling into the void. It is evident that our screams, our cries, our hurt goes unheard. Y'all have the opportunity to actually advocate and stand up against things that are blatantly wrong and racist. Do something.
This is a registered nurse named LaCrista Vaughn, and she sat here with complete disregard for a woman in active labor, screaming in pain, asking for help. And she responds to her and says, "I cannot help you." And this isn't even the first time she's been caught on camera with, in my opinion, a complete disregard for her patients. A Black trans man came in from having seizures, and according to him, he was treated like he was on substances. Which, by the way, even if someone was, they still deserve to be cared for. The woman that she treated this way, a Black woman who is already at a higher risk, she ended up delivering her baby 12 minutes after getting out of triage. Her baby had their first bowel movement while still inside of her. However, we have an update that they are doing well physically. You can't tell me as a nurse that she is not aware of the statistics of Black women in healthcare. To look at her in the eyes and say that I can't help you. And for anyone who's ever had a baby, you know how horrible this type of pain is. And I guess the hospital, allegedly, in my opinion, doesn't like all this attention because they shut down their comments. I found this post very concerning, where she says, "Any suggestions on switching specialties? Looking at moving from ER to labor and delivery. Are there any open residencies in DFW?" Thank God she didn't find an open residency, or she changed her mind. Because she, in my opinion, shouldn't be in labor and delivery, the ER, or any type of job that involves any type of care for human life. Giving birth to your baby should be a magical, safe experience where doctors and nurses believe you and they treat you with dignity and care. This mother should be able to go home and enjoy being with her baby and have walked away feeling safe, and they got the exact opposite. For what reason? I would love to hear in her words why she treated her that way. And lastly, for anyone who believes that there isn't racism in the medical field because maybe you're a nurse and you would never do that, if you can see a video like this and not see that this is happening, you're part of the problem.
I'm watching this clip of a Black mother, and I will show you this, in active labor at Dallas Regional Medical Hospital in Mesquite, Texas, and my stomach is in knots. She is screaming, she can't sit, she's doubled over in pain. Anyone with eyes can see she is in active labor, and instead of being taken straight to labor and delivery, she is stuck in that waiting room for over 30 minutes while someone registers her like she's checking in for a dental appointment. So here's the clip.
When's your due date?
Right now.
Is your due date September 11th?
What?
How many times have you been pregnant?
3.
This is your third pregnancy?
Yes.
You have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
There was a personality patient for you. Last name is Jones. She's G3P2. Not sure when her due date is.
Her due
I
date is
just
the
said it was
10th.
the 10th.
I think her due date is the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people here.
And the healthcare professional sitting right there doesn't acknowledge her pain at all. No urgency, no assistance, no call to labor and delivery, nothing. 12 minutes later, she delivered her baby. 12 minutes. So that tells you everything and exactly how close she was when she was left out there in agony. People love to pretend medical racism is some historical artifact, but this is exactly what it looks like today. This is how Black mothers die. Our pain is dismissed, our symptoms are minimized, care is delayed until it's almost too late, and then everyone acts shocked at the maternal mortality statistics. There is absolutely no universe where this is acceptable patient care. Active labor at that stage is an emergency. She should have been immediately transferred to labor and delivery, full stop. And if this is how she was treated before delivery, imagine how she may have been treated postpartum. And that is truly what scares me. I hope that this young lady and her baby are safe, but this cannot keep happening. Black mothers deserve better, and the system knows it. It is long past time to root this out entirely.
Now, let me tell you what really gets me. When a woman says she's in pain, believe her, especially woman in labor. There is no maybe she's exaggerating. Labor pain is not headache pain. It's not stomach upset. It is real, serious pain that can turn dangerous very fast. But the nurse acted like this woman was disturbing her mood. Like, how do you work in a hospital and still lack empathy? And this is happening way too much. Women being ignored when they say something is wrong. Nurses acting cold. Staff treating people like they are lying. And when something bad happens, everybody suddenly wants to be so sorry. Everybody wants to be sorry. No, be sorry when she's alive. Be sorry when she's asking for help. Be sorry before she collapsed. What if that woman had passed out right there? What if something happened to the baby? What if she was alone and couldn't even scream? This is the type of care that pushes people not to trust hospitals. Honestly, nurses and hospital staff need to stop playing with people's life. If you don't care about helping people, don't work in the medical field. It's that simple. A woman in labor should never be treated like she's waiting for her turn. She needed help. She asked for help and they ignored her. And people wonder why folks record everything now, because if you don't film it, they will act like it's never happened. Anyway, guys, what do you think about this whole situation? Drop your thoughts in the comments and don't forget to subscribe to the channel, like and share the video to help the channel out. See you in the next one. Bye.